Hey everyone, and welcome back to the channel. Have you ever felt just blah, down in the dumps? We all have those days, right? Feeling the blues is a part of life. But what happens when that blah feeling sticks around? Today, we're diving deep into the difference between having the blues and clinical depression. It's crucial to understand the difference, recognize the signs, and know when to seek help, because your mental health matters. Okay, let's start with the blues. Think of it as a temporary cloud passing by. You might feel down for a few days, maybe a little less energetic, or have a mild change in your sleep patterns. But here's the key. You're still able to function. You can still go to work, see friends, and enjoy some activities. You might even find yourself bouncing back pretty quickly. A stable weight and a quickly passing feeling of hopelessness are also signs you just have the blues. The blues are temporary and usually go away after a short time. Now, let's talk about depression. This is not just a case of the blues. Depression is a persistent medical illness. It can impact every aspect of your life. It may improve, but leaving it untreated means it will persist for many months or longer. If you're depressed, you might find little to no joy in life. You might have no energy, feel unworthy or guilty for no reason, find it difficult to concentrate, or be easily irritated. Sleeping patterns can be disrupted, waking up too early, or experiencing changes in appetite. Some people might eat much less than usual, while others might eat too much. The most serious sign is a sense of hopelessness, or even thoughts of suicide. If you have those thoughts, please reach out for help immediately. Let's break down the signs to make it easier to understand the difference. The blues. Feeling down for a few days, still able to function normally, lack of energy or mild change in sleep patterns. Enjoy some recreational activities, stable weight, quickly passing feeling of hopelessness, depression, persistent lack of energy, lasting sadness, irritability and mood swings, recurring sense of hopelessness, continual negative view of the world and others, overeating or loss of appetite, feeling of unworthiness or guilt, inability to concentrate, recurrent early morning awakening or changes in sleep patterns, inability to enjoy pleasurable activities, feeling as though you'd be better off dead. See the difference? It's about the intensity and duration of the feelings. Alright, so you're feeling the blues. What can you do to lift your mood? Here are some tips. Share your feelings with a trusted friend, family member, spouse, or your spiritual counselor. Spend time with other people. Engage in activities that have interested you in the past, particularly activities that you have enjoyed. Regular moderate exercise may lift your mood. Get adequate rest and eat balanced meals. Don't undertake too much at one time. If you have large tasks to do, break them into smaller ones. Set goals you can accomplish. Look for small opportunities to be helpful to someone less fortunate. Avoid alcohol and sedative drugs. It's important to understand that depression isn't a sign of weakness. It's a medical illness. In the U.S., more than 19 million adults have a depressive illness. Sometimes it's a side effect of a prescription drug, illness, or poor diet. Imbalances of certain brain chemicals may be a factor. Often the cause is unclear. You're at a higher risk if a blood relative has had it or if you've experienced it before. But don't let these factors control your life. And don't delay seeking medical attention if you notice recurrent depressive symptoms. Depression may also be preceded by a severe shock or stress in life, such as the death of a loved one or the loss of a job, or it can arise when things are going very well. It is normal to feel sad after losses or setbacks, but that sadness doesn't stop fairly quickly. A serious depression likely is developed. Depression may not go away by itself. Don't expect to snap out of it all of a sudden, or expect to be able to beat your depression through sheer determination. If depressive symptoms last more than a few weeks, or if you're feeling hopeless or suicidal, it's time to seek help. Don't blame yourself for feeling depressed. It's not your fault, and it's not a sign of weakness. Contact your family doctor or psychiatrist. The psychiatrist, just as your family physician, is trained as a medical doctor and can help you with medical illnesses that might be contributing to your symptoms. If your symptoms have been mild but persistent, a psychologist may be helpful. A psychologist is trained in various types of psychotherapy, but doesn't have a medical degree. Discussing feelings with a family member or close friend is helpful, but it is no substitute for seeking professional help. If you know someone who is depressed, here's how you can help. Invite him or her to take part in normal social activities. Encourage participation, but don't overdo it. Friends and family should encourage and support professional care. The problem should not be trivialized. It should be viewed as an opportunity to help because depression can be treated successfully in most cases. Offer reassurance that things will get better, but don't expect a depressed person to improve suddenly. Don't minimize a depressed person's feelings. Listen carefully to what he or she says. Seasonal affective disorder, or SAD, is another form of depression that seems to be related to light exposure. It occurs in the northern and southern hemispheres, but is rare in people living near the equator, where daylight hours are long. The disorder is more common in women than men, and sometimes is treated with increased light exposure during the day, obtained with a light box containing a source of bright, broad-spectrum light. Grief can also be a trigger for depression, especially if it's prolonged or severe. Express your feelings. Write a book of memories, or even a letter to the person who died. Ask for help. When we experience sudden loss, our friends may not know how to respond. We can relieve others and help ourselves by asking any specific kinds of help. Stay involved. People who grieve may need to remind themselves about exercise, diet, and rest. Evaluate yourself for depression. If the grief is extremely severe in the short run or persistent over the long run, 6 months or more, consider depression as a possible cause. Remember, you're not alone. The blues are temporary, and depression is treatable. If you're struggling, please reach out for help. There are resources available and people who care. Thank you for watching. Please like this video, subscribe to the channel for more mental health content, and share this video with anyone who might find it helpful. Take care of yourselves, and we'll see you in the next video.